Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. We are still doing our sessions in patient safety. This session is about communicating with patient after an adverse event or after adverse events. The learning objectives of this session to explain why communication is important after an adverse event, discuss appropriate steps to follow after an adverse event, describe the importance, structure, and content of effective apology. Imagine that you have been in your desk studying or doing some work and you left for something and then you found that someone spilled a coffee in your book. Or imagine that your neighbor come and said that your son has broken his window. Or even for you as a medical provider, imagine you prescribe wrong medication. For example, a patient with asthma, and you prescribe beta blocker, and next week he come with wheezy and shortness of breath and cough, and you recognize that you committed a mistake. How do you feel about that? And if you are the victim, if you are the one who has the coffee spilled on his book, or his window is broken, or if you are the patient, what do you want? Whenever something wrong or an error or mishaps happen, there is a victim and there is the cause. The victim usually has a range of emotion, and this also happens to the cause. He has a range of emotion. The victim feels that he's angry, frustrated, disappointed, and he need explanation why it happened, who did it, why. Is it an accident? Is it an intention? Is it an error? Is it a violation? And at the same time, the person who committed that error or mistake, he feel frozen, he's panicky, he's guilty, and he's afraid. And might be hesitant to do certain effect to correct the situation. For healthcare provider, they work in a culture that traditionally expect individual to do perfect job, error free all the time. It is harder to communicate bad news when your professional identity and competence appear to be at the stake. Why communication after adverse event is difficult? We would like to preserve our sense of self, fear of admitting responsibility for making an error that might have hurted someone else. And also, we are afraid of the anger and the reaction of the other, or even if we are worried about the reaction of the authority, hospital administration, or the medical council, and so on. Fear to lose our job, and threat of medical malpractice and claim, and fear of colleague disapproval, or even the public reputation and negative publicity. After an adverse event, certain communication should happen with the patient and the family. And in Veterans Health Administration, they call it disclosure. It is about discussion of clinically significant fact about what happened between the provider and the family member, telling them what happened and anticipated harm. Some authority use the term communication as opposed to disclosure because they feel that this word, it has sense of openness, reciprocity. It implies continual dialogue, and anyhow, even whatever the term, some communication should happen with the patient. It should be prompt, it should be compassionate, it should be honest. So imagine that you did a hip surgery or a knee surgery for a patient, and the resident prescribed an overdose of narcotics. Then the patient become delirious, confused, then he did inappropriate movement, that he has significant bleeding requiring blood transfusion. So what will the second day, the patient is more oriented and aware, and he knew about the incident. So there are a lot of questions in his mind. So how bad is the situation? Did the procedure went wrong? Did it go wrong? Will I permanently be harmed? Even he can consider that, is it going to result in death or significant disability? Will the bleeding stop? How much blood do I need? How long will I have to stay in hospital? And what other treatment do I need? And who will take care of my family? And for how long I will be absent from my job? Will this stop me from going back to work again at any period of time? To address all these questions, open communication is the most important things to do. Communicating openly with patient is simply the right thing to do. That is the first and foremost reason to do it. It is the patient right to know and to have an explanation about what happened. Open communication is likely to benefit the patient and to caregiver. Even when we do mistake or an error, when we speak to the victim and when we apologize, we feel better about that. And it is a fundamental ethical requirement to be honest and to be truthful. Even we are worried about liability, but effective communication with sincere apology, it tends to reduce the risk of lawsuits. There is a study published in Lancet, and it showed that the patient and the family member, they are very much interested in communication because they are concerned about standard of care. They don't want this to happen to them again or to happen to someone else. And at the same time, they need an explanation what happened and why it happened, who is accountable. And some people are looking for compensation. And if you take care of them and you take care of the bill and the consequences, many of them they will not go for a lawsuit. So, how to deal with the patient after an adverse event? The first step is to take care of the patient. So, when we recognize an error has happened, even before the patient develop any symptoms or consequences, we should take care of that patient. For example, if we give an insulin, then it's a wrong dose of insulin, it is very important to put that patient under monitoring and check his blood sugar according to the half-life of insulin. And if he becomes symptomatic and having hypoglycemia, then we have to treat that. If he get hypotension, we need to correct that. If he develop an arrhythmia, if he has bleeding, so the first step is to take care of the patient and provide appropriate medical care. And also, if there is an impaired provider, we have to take him away. If there is defect in an equipment, infusion pump or monitor, we have to take them away from the patient. And so immediately secure any drug, equipment, and record involved in the event. So we have to address all the patient need immediately. The second step is to communicate with the patient. And here it is usually immediately after the incidents, we don't have a lot of information, but it is important to tell them that something happened, what went wrong, and what are the expected consequences, and what are you going to do, and how are you going to take care of him, and what are the monitoring or the management strategy you're going to implement. And at this time, it is better not to accuse or blame anyone because you don't have all the information, but promise that you're going to investigate, you correct the situation, and you address anything that goes wrong. So, when you do this communication, make it very simple. You have to express empathy and compassion, and don't blame anyone, and promise that you're going to investigate and you're going to update them every now and then about what happened. But who should do this communication? This is a very important question. This communication usually in some hospitals they have risk management, they take care of that, but it is always important that the clinician taking care of the patient and the nurse taking care of that patient should be there, because the clinician and the nurse they can address the treatment plan and the treatment strategy after this adverse event. And it is also recommended that if there is a family member that can help and support the patient, and if there is a case manager also, because they can document and put things on the chart. Presence of another physician and can help to reduce the conflict and explain the situation in a better way to the patient and to correct any miscommunication. The third step is to report. To have an incident report, you have to fill that incident report immediately and to send it to the appropriate authority, and you have to document everything in the chart. And also everything should be documented in the chart: what happened, what treatment is done, what communication has happened, who has been there. Detailed note should be there. And after that, then apology is very important, and we're going to talk about it in more details. So apology is very effective tool. It is an art more than a science. It is not that something that come naturally to most people. So some people are very skillful in delivering sincere apology, but it's also that something that we can learn and we can improve with time. Sincere apology can be an immeasurable healing to the patient and even to the provider himself, also to the caregiver. If it comes from the heart and it shows that there is some regret. Some institutions see apology as a risky endeavor that reflects that they are admitting their guilt, and this might increase the risk of litigation and lawsuits. Apology, it has to be sincere, it has to come from the heart, and there are some pillars for apology: acknowledgement, explanation, expression of remorse, shame and humility, and reparation. And genuine apology begins the healing process for the patient. It helps to restore the patient dignity, and it helps the staff to be involved in with the patient trauma, and so they can provide appropriate treatment. So apology is the major step toward restoring the trust and relationship with the patient, between the patient, the provider, and the institute. If it is not done in a appropriate way, if it is just like a casual, and if it is done for not for the right reason, or it is done for the wrong reason, it can increase the damage and it increase the trauma of the patient. So the first step in apology: acknowledgement. The first part is to acknowledge that the event has happened, and if we know who are involved, we need to tell the patient it is Dr. X and the nurse X. Appropriate detail of the event and validation that behavior is not acceptable. And so part of this, it is when you do good and effective communication with the patient after adverse event, it paves the road for good apology. So acknowledging it is implanted in the step of good and effective communication with the patient. And part of that is to explain. It is a second part of apology: explanation for committing the event. Explanation may mitigate the event. For example, if you come late to your clinic because I was involved in a busy surgery or in a busy procedure, or if you explain exactly what happened, then people can understand. Sometimes saying there's just no excuse for what happened, that you are accountable, and it shows that you are honest and you have a dignity and you respect your patient dignity. So through this explanation, the provider accept his responsibility for the event and make it very clear that the patient did not do anything wrong. And at the same time, you have to express remorse. Expressing remorse, shame, and humility. This is a very important part in sincere apology. Remorse is a deep sense of regret. Shame is the emotion associated with failing to live up to one standard. Humility is a state of being humble, not arrogant. Lack of remorse, shamelessness, denial, and arrogance will damage the apology, and it will not appear as a sincere and effective apology. So the final step is reparation, uh, which can range from, for example, you can schedule your patient for an early appointment, and if he need to stay longer in hospital, then um, you can take care of the bill, or if they have to buy some medication, you will take care of them. But here you have to be careful if it is your authority or not. I remember one time I have a patient who has to stay 2 more days in the intensive care unit. And I promise the family that I'm going to speak to administration because it is not my privilege to give that promise. So all these components are important, and whenever there is defect in apology, it will be either in acknowledgement or explanation or in showing remorse or even in reparation. So this, to summarize about structure of apology, it is about associated restoration of self-respect and dignity, and the patient feel that the provider and institute are taking care of him. It is restoration of power. So people, you are the focus, and people are coming to you, and it is restores the dignity. Uh, it also, when we show the remorse and regret, it shows suffering in the provider, and it has some healing effect on the victim. Validation that an offense has occurred, we admit, and it showed also accountability, and it tell about who did it, and assurance that we are sharing the same value. We want to be honest, we want to be truthful, and we want to take care of you. And it encourages the dialogue, and whenever there is compensation and reparation that can be done during this process of apology, and it promises for future improvement and accountability. So apology, it is important. It restore dignity. It restore dignity because by acknowledging that the event happened, and that we are, as a caregiver, we value our patient and we value his dignity, and it also it gives assurance to the patient that he will not be abandoned, and we will continue to take care of him. And we as care provider and organization, we are engaged in dialogue with this patient. Sincere apology also help to restore relationship. When the provider who committed the mistake, and when he goes to the patient and he tell and he explain and he showed remorse and regret, and he promised to do the best care he can do, this can help to restore good relation with the patient. And also it help to determine accountability, and also setting goals by having a strategy about what to do and how to do it. So after an adverse event, take home, we need to take care of the patient, we need to address his urgent need, we need to protect the patient from continuous harm, we have to communicate, and this communication is a pillar for future sincere apology, and we have to explain the situation, and we at the same time we need to make appropriate report and document in the medical record and to write an incident report. And the fifth pillar is the apology. Apology require acknowledgement, explanation, expression of remorse, shame, and humility, and reparation in response to patient journey. And thank you.